Welcome to The Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone and welcome back to The Hair Loss Show. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen, and I want to thank all of the wonderful subscribers and people who view our videos. You've made this a bigger success than either Vikram and I could possibly have hoped for. And we love the feedback that we're getting, so keep them coming in. We like to be able to answer the questions that are obviously concerning the general public about the issues we discuss. So please feel free to keep contacting us and we'll do our best to answer your questions.
Great, so for this episode we thought we'd tackle a question that we get frequently, and that is a question on scalp biopsy. So, we see people with hair loss on a daily basis, and the question is, do you do scalp biopsies? How frequently do you do scalp biopsies? When do you do scalp biopsies? Does everyone need a scalp biopsy?
Okay.
What are your thoughts on that?
My thoughts about this are, firstly, that's a very specialised field of derm pathology, and that if you're going to do scalp biopsies, you need to have a very experienced person to analyse them.
To read the histology, isn't it?
To read the histology. So, it's important that you identify that person who's got experience at it and knowledge of it, because otherwise you get some pretty wishy-washy answers. I'd have to say, again, just as a general observation, that the reports we get back on scalp biopsy are really not very conclusive. They really work along the lines of features consistent with, it could be something along the lines of. So in other words, it doesn't make the diagnosis for you, it's more about confirming the diagnosis. So that's the first question or the first answer that I'd give you to your questions, and that is, if I'm unsure about what I'm looking at, then a scalp biopsy may help clarify the issue for me. But I'd also make the point that what we do in our practice, which I would encourage other doctors to do, is to use 50 power magnification video microscopy on all of our patients. And that solves a lot of problems compared to trying to make up your mind about things naked eye. So for example, if we can see the pores in the skin where the hairs come out, called the follicular orifices, if we can see them, we know we're not dealing with a scarring issue. So that's rarely going to require a biopsy. I'd say that the most times that I would consider doing a biopsy is if I saw some scarring tissue of an unusual formation on the scalp and I really wasn't sure what I was looking at, then probably you could do a biopsy. And again, it's important where you biopsy.
Yes.
So for example, if you have an area that you think needs a biopsy, you biopsy at the edge, not in the centre, because these things tend to spread outwards, and so you want to be in the active part of it. But as a general rule, I'd say that mostly I don't find it necessary to do it. I know that dermatologists are trained to do biopsies a lot, so a lot of patients come to us from dermatologists with biopsy reports, which is why we get to read things that features are consistent with. And that's nice from that perspective, but I don't see it as a huge part of my everyday practice.
No, sure. And I think the key, one of the points I would make is a biopsy is a very small and relatively simple procedure in the gamut of operational procedures. But that said, it does leave a scar, right? So it's not something that I would advocate, for everyone and anyone. And certainly with something that certainly you and I deal with on a regular basis, which is androgenic alopecia, that can be generally diagnosed exceptionally well with a dermatoscope and doesn't really need biopsy to confirm, the diagnosis. So I think both of us, I'm sure are in agreement that we don't routinely do biopsies in our patients who we've, by visual examination and with dermatoscopic examination can ascertain that we're reasonably confident that this is the diagnosis.
It gets down to a more sophisticated level too, because the type of white cells, if you like, inflammatory cells that you see around the bulbs can help differentiate between different types of scarring alopecia, because sometimes they're quite evident from a clinical perspective. Sometimes there's subclinical, meaning you can't really see it. So sometimes that might be helpful as well. If patients come to us with biopsies, well and good, we take that into consideration. But I think we would agree on the point that because of the way we examine our patients carefully with magnification, the dermatoscope, the video microscopy, that gives us a lot of information that usually allows us to avoid having to go down the path of creating an invasive punch biopsy, or more than one. It has to be of a decent size, otherwise it's going to be of no use to you, and that creates a decent scar. So again, we try to avoid it if we can. So I hope that helps. It's if you are going to an experienced doctor who understands what he's looking at, and he can have a good magnified look at it, a microscopic look at it, you're probably not going to end up with a biopsy.
Yes, but I mean, to your point, and this is an interesting one, because I know that there are dermatologists or hair physicians who do biopsies. They do have a relation, or they do know a histopathologist, and they will specifically send it to a specific histopathologist to actually read, not just send it to the lab and whoever's the nearest pathologist can read it. You want someone who's specifically trained in understanding what the intricacies of hair.
Too is that some of these doctors who do routine biopsy are investigative.
Yeah.
Right, and they are collecting a series of patients and trying to analyse and collect the data. And it may be helpful in the treatment paradigm, but it's more likely to be helpful in the diagnostic paradigm.
Yeah, because we had. I mean, to this point, I mean, we had the patient today, didn't we? That we saw that on examination is not. We're pretty confident is not androgenic alopecia. So that one
it mimics it. So this is the thing, right? There are conditions that mimic male pattern balding or androgenic alopecia, and if there's any suspicion that you're not looking at a classic case of androgenic alopecia,
then
and you're not sure what you're looking at, then clearly a biopsy is indicated.
Yeah. Good. Well, I hope you found that useful. Thanks again for watching, and we'll see you on the next episode.
Take care.
See ya.